In 1777, a Revolutionary War general faced a grim threat: smallpox. The disease had ravaged the British troops and had a 30% mortality rate. There was no good treatment, but there was something you could do: inoculation. Take a small sample from an infected person and inoculate an uninfected one. They'd get sick, but not as sick. The death rate was about 1 to 2%, but then they'd be immune. The general mandated inoculation of the entire United States Army, a difficult decision that, according to some historians, saved America from losing the war. That general, of course, was George Washington. There was immediate pushback when he made that decision. This was 19 years before the actual smallpox vaccine, which carried virtually no risk of death. That was developed by Edward Jenner. Religious leaders at the time complained that inoculation interfered with the will of God. Libertarians railed against the mandate, even when applied to troops. Doctors of the time debated whether this inoculation process would even work. That story is history, but it doesn't sound all that unfamiliar to me. The concept of vaccine hesitancy is as old as the concept of vaccines. I'm Perry Wilson, a physician and researcher at the Yale School of Medicine and the Yale School of Public Health. Today, we're looking at a HealthDay Harris poll of over 2,000 American adults that tried to drill down on their opinions about vaccines. To help me parse through the data and tease out what is going on with vaccine hesitancy, I'm joined today by Dr. Peter Hotez. Dr. Hotez is Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, where he is also the co-director of the Texas Children's Center for Vaccine Development and Texas Children's Hospital Endowed Chair of Tropical Pediatrics. Dr. Hotez, thank you for joining me.
Thanks for having me. Great to be here.
So we're going to dig into this polling data in a minute, but before we get started, there's sort of an overarching issue when we think about vaccine hesitancy, and it has to do with NIH funding. So we have multiple news outlets now, PBS, the Washington Post, reporting on NIH cuts to previously approved grants that were already being funded. And the goal of the grants was to study the concept of vaccine hesitancy, the drivers of it and whatnot. What do you think is going on here? Is there value to studying the very concept of vaccine hesitancy at all?
Well, there certainly is, because I don't think we really fully understand all of the social determinants of vaccine hesitancy. And the problem is vaccine hesitancy is now a lethal force in America. My last book, The Deadly Rise of Anti-Science, showed that 200,000 Americans needlessly died, including 40,000 in my state of Texas, because they refused COVID vaccines. And it wasn't misinformation or infodemic, as we commonly call it. It was a targeted, organized disinformation campaign. And so 40 to 50,000 Texans and 200,000 Americans, that's a pretty serious number of deaths. And now, of course, it's spilling over to childhood immunizations. Right now, where I am in Texas, we're enduring a horrific measles epidemic with 40 kids in the hospital and 1 pediatric death. And so this is an important cause of illness and serious illness, hospitalization, even death in America right now. So it's important to study. Unfortunately, it's part of a larger erosion in trying to dissolve any sort of pandemic preparedness. We're hearing about a number of coronavirus diagnostic and vaccine grants being canceled, and we're definitely going in the wrong direction in this country because, as I've been writing about, COVID-19 will not be our last major epidemic. We've had SARS in 2002, now SARS-2. We've had Middle Eastern respiratory syndrome. We've had 2 major Ebola epidemics in West Africa and DR Congo. We've got a rise in arbovirus infections. And so this is a new normal, and mostly due to climate change and urbanization and other factors. So it's going to be important to kind of turn this around.
And of course, we've got millions of poultry and cattle infected with bird flu.
Yeah, we have this thing called H5N1, and that's absolutely right, yeah.
So obviously concerning. One of the things that stood out to me in this poll, so this is a poll of 2,000 Americans, all walks of life, asking what they think of vaccines, what makes them more likely to want to get vaccinated, what makes them less likely to want to get vaccinated. And really the strongest thing out there in terms of motivating people to get vaccines was personal experience with the disease.
Well, I'm not even sure it's really true. I mean, I don't doubt that's what the polls showed, but whether people are being genuine in their response. I mean, look what happened with COVID, right? I mean, 200,000 Americans died because they refused a COVID vaccine, and yet, in areas, more conservative areas, more rural areas of the country where people refuse COVID vaccines, they're still doubling down. They're still not getting boosters and that sort of thing. So I'm not even convinced that that is what turns people around. And of course, you don't want to wait for an epidemic to convince people of this. And even here in West Texas, where we're seeing a large measles epidemic, there is some of a catch-up campaign, and now people are starting to get it and getting vaccinated, but a lot of people aren't. So I don't know that we want to rely on that as our long-term approach.
Yeah, absolutely. Thinking about the COVID vaccine in particular, one thing I always remember is in the early days, right after the vaccine came out and was in short supply, there was incredibly high demand for it. People were lying about their occupations to get on lists to be able to be vaccinated. That scarcity almost drove this mentality, and then something changed, and we've all seen that change. But I've never exactly been able to figure out what that change was, from seeing the vaccine as kind of the relief to everything we hated about COVID, the lockdowns and school shutdown. Like, here was finally something that was going to change the game. And it was, only maybe it was by 6 months after that point in time, we had this large anti-COVID vaccine movement in this country. What drove that? What happened, in your opinion?
Well, when you look at when vaccine rates started to noticeably stall, it started in the spring and into the summer of 2021, which unfortunately coincided with the beginning of that horrible Delta wave. And now we're starting to really understand it. And unfortunately, it brings us into the political realm, which we don't like to talk about as physicians or scientists because we always want to be apolitical. But my colleague Charles Gaba, who is a Uber number cruncher, has an organization called ACA Signups, was the first to find it, and then it's been reproduced by the New York Times and Axios and National Public Radio. And he showed that those that were not getting vaccinated after the spring of 2021 were very much in red states, and the numbers show the redder the county, meaning the higher percentage of Republican voters, the lower the immunization rate and higher the death rate. So it was very much along a partisan divide, and it was happening because of a targeted disinformation campaign that came out of members of and I actually wrote a book about it called The Deadly Rise of Anti-Science. It came out of members of the House Freedom Caucus, people like Marjorie Taylor Greene, the representative of Georgia, called People Like Me medical brown shirts, comparing vaccinations to the Holocaust, and Senator Jim Jordan, not Senator Ron Johnson of Wisconsin, holding these kind of phony baloney vaccine injury roundtables, and Rand Paul, and then the pile, and we can document the role of Fox News during that Delta wave, and Joe Rogan podcast. So it became this kind of whole vaccine ecosystem where that's where you were getting your information, from Fox News and elected members from the far right and Rogan podcasts. You basically made an executive decision that ivermectin or hydroxychloroquine was as good or better than vaccinations, and of course it has no effect. And you decided not to get a vaccine, so they were victims of this coordinated political disinformation campaign, and that's what we're up against right now. Is this is becoming a deadly force in America.
I'm certainly not doubting that there was misinformation about the vaccines, both in terms of efficacy and side effects. But what I wonder is what you think the motivation for spreading disinformation is. I'm not content to think it's just out of malevolence or.
No, I think what it was, a few things. I think it began as a sort of a political identity and a pushback to vaccine mandates, which you could sort of understand. And for instance, you saw this, and I benchmarked the CPAC conference of conservatives, and Dallas in July 2021, where, this representative from North Carolina, Matthew Cawthorn, said something to the effect of, first they'll vaccinate you, then they'll take away your guns and your Bibles, and okay, political rhetoric and against mandates. You could sort of understand it, but the problem was at that CPAC conference of conservatives, they then used it as a platform to bring on all the most toxic, virulent anti-vaccine activists to go the next step and falsely discredit the effectiveness and safety of vaccines. So in their zeal to push back against mandates, they overstepped and then felt the need to say the vaccines don't work, or they're political instruments of control, or they're unsafe, and that's what we've been dealing with ever since, and it continues to take on that kind of extreme character. So, for instance, you had the Florida Surgeon General, Dr. Ladapo, is a Harvard medical graduate, gets up there and talks about how mRNA vaccines are causing turbo cancers because they're integrating into our DNA and our genome. And so I had to go on the cable news channels and say, wait a minute, there's no such thing as a turbo cancer. It's a made-up term. And by the way, the lipid nanoparticle can bring the nucleic acid into the cytoplasm, but to get it into the nucleus, you need electroporation. And that's why we don't have a DNA vaccine. And even if there is residual nucleic acid that gets inside the nucleus, we have proteins of our innate immune system that block integration. That's why, otherwise, every time we ate a hamburger, we'd have cow DNA integrating into our genome. And but unfortunately, this is what's been happening now. Part of the politics now is really focused on discrediting vaccines, and now we're seeing it with Robert F. Kennedy Jr. During our measles epidemic, as Health and Human Services Secretary, it's talking about everything but vaccination, and talking about budesonide, a steroid, and vitamin A, which has no preventative properties, and clarithromycin. I mean, and so part of it is, this kind of pushback against mandates, overstepping bounds to feel the need to discredit vaccinations. There also is a link with the health and wellness nutritional supplements industry that's pushing alternatives like ivermectin and hydroxychloroquine. And several reporters have documented now that organizations that are doing that are also selling telemedicine visits, which they then give out the ivermectin and that sort of thing. And so there's that whole kind of corrupt health and wellness nutritional supplements industry on top of it. So it's now this whole ecosystem.
Any student of American history, even a bad one like I was back in the day, would say that there's a strain of libertarianism in this country, an independence, rugged individualism, sometimes called, where, don't tell me what to do.
Yeah, this is what de Tocqueville wrote about, right?
Absolutely.
In the 1800s,
and
right?
So was it inevitable then that a mandated vaccine was going to lead to this type of backlash by one political party or another? And if so, should we have known better? And should our approach have been different up front?
Well, and I'm writing a new book now with Michael Mann, the climate scientist, and we're comparing the attacks on climate science with biomedicine, and it's called Science Under Siege. It'll be out in September. There is that libertarian thread, and it started actually in the early 1800s, just when de Tocqueville was all over the Midwest and South, and there was a man named Samuel Thompson who sold this whole system of what he called botanicals in the Midwest and the South, and fought against pushback from the more established medical profession. So it's a thread that goes back all the way to the early 1800s. And shunned regulation of the medical profession. Of course, the problem now we have something called the internet and something called social media and the podcasts. And so the amplifying effect is huge. I think for me, though, it was the linking of it to an industry that's making money at an unprecedented scale, and the adoption by an American political party is what did it. I mean, I remember when President Biden put in those mandates, and it was, in my view, I mean, I don't have the inside baseball on it. In my view, it was just born out of frustration because they knew the Delta wave was coming and it was going to be a killer. And at that time, early on, when there was a good match between the virus and the vaccine, there was actually interruption of infection and transmission, not as strong as symptomatic illness. But in Israel, during the Alpha wave, they showed that mRNA COVID vaccines, 2 doses for a Pfizer vaccine, was protecting 90% in terms of reducing not only symptomatic illness but asymptomatic infection and that's why and transmission, because the level of virus neutralizing antibody was getting to be so high in the nasal mucosa and the throat washings that it was actually stopping virus shedding. And that was the whole reason why I think the CDC said the mask can come off. They didn't really articulate it that way. But then and that may have been also and part of the reason why the Biden administration decided to move forward with mandates, because there was evidence that it was interrupting transmission, and you could potentially have that benefit. But I think as the virus started to mutate, first to the Delta variant, and then, of course, to the Omicron variants, it was still protecting against serious illness and death, but you were losing that protective function against asymptomatic infection, and there was still some effect, but it wasn't as strong. So that was also part of the problem, was the changing nature of the virus.
You mentioned social media as an accelerant for vaccine hesitancy. The Harris poll shows actually that only 1 in 3 people said that influence from online communities influenced their choice of whether to vaccinate or not. Is that one of the statistics that you believe, or do you think that people are underestimating the effect of social media on their personal choices?
Well, again, I think, social media was a component, particularly as Twitter morphed to X and started inviting back all the anti-vaccine activists. That's a component. I think the cable news channels, Fox News, was a big driver of vaccine hesitancy during the Delta wave. The podcasters, the conservative, I use the word conservative, not really conservative, sort of MAGA podcasters who railed against vaccines, were also, a component of it. So in that sense, yes. I think the online stuff, or at least social media, is just part of a larger communications ecosystem that's out there.
You're hearing it from everywhere. Right now, as you've alluded to, we have vaccine skeptics, might be a kind word here, but in the highest positions of power within national healthcare, led by RFK Jr. at HHS, it's a little hard for me to even ask this question about how we move forward from here, how we improve uptake, improve understanding about the vaccination and the vaccination program, defend against the next potential pandemic, start to change society to embrace the scientific method. But you've thought about this more than just about anyone else. So where do we go from here?
Well, it's going to get harder. The Washington Post just recently reported that RFK Jr. wants to reopen the vaccines as a cause of autism links, and that's how I got involved in this. I'm a vaccine scientist. I make low-cost vaccines for the world, and 100 million doses of our vaccine technology have reached India and Indonesia. That's what I wanted to do with my life as an MD, PhD, pediatrician scientist. I only got involved in it because I have 4 adult kids, including Rachel, has autism and intellectual disabilities, and wound up writing a book called Vaccines Did Not Cause Rachel's Autism, and that wound up making me public enemy number 1 or 2 with anti-vaccine groups, and had long discussions with Robert F. Kennedy Jr. And in the book, I do a deep dive showing the massive amount of scientific evidence that there's no link between vaccines for autism. But equally important, or more important, is the lack of plausibility, because autism occurs in early fetal brain development through synaptic connections, through the actions of 100 autism genes that have been identified. Most of them involve in synaptic connections. A lot of them are neuronal cytoskeleton genes. We actually did genomic sequencing on Rachel and my wife Ann and I to find Rachel's autism gene, and it's similar to the ones first identified by the Broad Institute at Harvard and MIT. The point is, we know what causes autism. It has nothing to do with vaccines. It doesn't mean that there's no environmental influence, But if it is, it's something occurring around the time of conception, early fetal brain development, interacting with autism genes. For instance, if you're pregnant but are not aware of it and you're taking the anti-seizure medicine Depakote, also known as valproic acid or valproate, that's been shown to interact with autism genes and can cause an autism phenotype. And there's probably other chemicals in the environment can do that as well. And that's what we need to be investigating. And it makes sense as opposed to something like vaccines. So all this, obsession with vaccines on RFK Jr.'s part and his followers, all it does is it takes away from really understanding, having any hope to really understanding the environmental impact of autism, understanding how autism gene works, how to provide support for families with kids on the autism spectrum, and how to help adults. Now Rachel's an adult with autism and intellectual and developmental disabilities. So that's the problem, is it sucks all the oxygen out of the room and prevents us from addressing real problems. And of course, it only will contribute to vaccine hesitancy.
I saw the reporting about renewed investigations into a potential vaccine autism link, despite, as you point out, the hundreds of prior studies that have explored this link and found that there's no relationship. Is a federally funded study under the control of someone like RFK Jr. paradoxically a good thing? If this study is rigorously conducted, you would expect that it will also find no link between vaccines and autism. And will that start to convince people? Or is your fear that there will be a thumb on the scale somewhere?
Yeah, the thumb will definitely be on the scale. And remember, we've got very good studies, right? I mean, these are large cohort studies with hundreds, sometimes thousands of kids. And it's not only the epidemiologic studies. And, one of the problems is the anti-vaccine guys just keep switching up what vaccine they're concerned about with the hopes that they'll finally find something. So, for instance, the original assertion was the measles, mumps, rubella vaccine, the MMR vaccine. Then when that was debunked, they switched it up. This is when RFK Jr. got involved. He wrote an article in Rolling Stone magazine claiming that it was the thimerosal preservative that was in the vaccine. And again, the scientific community responded. Large epidemiological studies, big cohorts of kids, also non-human primate studies along with it. These are very expensive studies. And then they switched it up again to spacing vaccines too close together, or alum in vaccines. So what they would do if this goes forward is they'll pour over reams of data, and they'll keep on, finding subsets of subsets of subsets till they come up with some odds ratio of 1.2, and then that'll just barely reach statistical significance of some type, and then they'll say, aha, this is it, and it's really unfortunate. This is just all, this is pseudoscience, right? This is what they teach us in medical school and graduate school to avoid.
Yeah, we call it cherry picking in my in my epidemiology courses. There's a positive signal in the polling data that I wanted to mention. 90% of those surveys said they went to their healthcare providers for vaccine information, and over 70% said their healthcare provider has an influence on their decision. So that's good. Is that the solution? If the federal government isn't going to be helping us in terms of reducing vaccine hesitancy and improving public health in this way, are local doctors, local practitioners, boots on the ground, going to start changing hearts and minds? Well,
I think that's the best possible outcome, right? Because that's why you have a health provider. I mean, I'm trained in pediatrics, where we do a pretty deep education into vaccines, how vaccines work, and so certainly pediatricians and pediatric nurse practitioners should be trusted messengers for that. And so that's appropriate and a positive finding. And of course, now we have all these new adult vaccines, right, for RSV and of course flu and Shingrix and Prevnar, and so now the internists presumably are getting a pretty deep dive into vaccines, and the OBGYNs as well. So that would be good news, of course, if people could rely more on their healthcare provider, because I think that's probably one of our best hopes is a trusted messenger. It may not be sufficient, but it's certainly the right direction.
I want to be respectful of your time. Any final thoughts before I let you go, Dr. Hotez?
Well, I think I'm very concerned about the rise in deaths from vaccine refusal during COVID. I'm worried about spilling over to childhood immunizations in the U.S. I'm worried about it globalizing to other countries as well, that U.S.-style anti-vaccine activism. And I'm not sure I know how to easily walk this back, because, if people are tying their identity to it or political identity to it, that's going to make it much tougher. And, one of the things that I say is I don't care about your politics. That's your right as an American citizen. I'm agnostic about your political beliefs, but how do you say don't adopt this one because it's so dangerous to your health and the health of your loved ones? Don't adopt it, and all the other stuff, that's your right as an American citizen, but don't adopt this. And it's very tough to thread that needle or have that nuance. So what happens is I tend to get too often treated as a political individual when I'm absolutely not. And the other problem with it, of course, is the anti-vaccine movement attempts to demonize healthcare professionals and scientists who disagree with their views and portraying us as cartoon villains or public enemies. And that's a very dangerous route as well and very demoralizing. So it's going to be really important to see how we can walk this back. I don't see the current events putting us in the right direction, maybe down the road.
I have to see what the future will hold. Well, Dr. Hotez, thank you for joining me. Thank you for providing low-cost vaccines to the world and saving the lives of children. We appreciate it. You stay healthy.
Thank you. You too. And thank you for all your good work.